Hi everyone, this is my videos of the shoulder special test. The first one that we're doing is Yergason's, which is for biceps tendon pathology. So I'm going to instruct the patient to put his arm at 90 degrees, and then he's going to resist me with supination and external rotation at the shoulder while I provide resistance. Good. The specificity is 79, the sensitivity is 41, the positive likelihood ratio is 1.94, and the negative likelihood ratio is 0.74. The test is not really specific or sensitive, I would say. The positive likelihood ratio is a good number, showing that the patients will have this condition, and the negative likelihood ratio is not really anything relevant. The next test we're going to do is the empty can test. There are two likelihood ratios, but we'll just do supraspinatus tear, as this is for supraspinatus pathology. The specificity for a tear is 39, the sensitivity is 76, positive likelihood ratio is 1.25, and the negative likelihood ratio is 0.62. Again, nothing really too significant there except for the positive likelihood ratio for ruling in the condition. And then for the impingement, we have the specificity of 50, sensitivity of 87, a positive likelihood ratio of 3.90, and a negative likelihood ratio of 0.57. So the things that are the most significant there are the sensitivity, which would rule out the condition, and the likelihood ratio of 3.90, which would be good for having the condition. So I'm going to have the patient, he's going to abduct his shoulder straight out to the side like this. Good. And then I'm going to have him hold his arm there while I resist. Good. And then I'll let him go ahead and relax. And then we're going to have him bring his arm out in the horizontal plane, turn the thumb down. That's the empty can part. And then I'm going to again resist. Good. And our last test, go ahead and relax, is the drop arm test. Again, it's testing the supraspinatus. The specificity is 83, the sensitivity is 41, the positive likelihood ratio is 2.41, and the negative likelihood ratio is 0.71. The specificity, so for ruling in the condition, is 83, that's pretty significant compared to the sensitivity, and the positive likelihood ratio, again, for having the condition also is fairly high. So again, this is supraspinatus, also could test any of the rotator cuff, specifically a tear. And the patient's going to abduct the arm to 90, so he's going to bring his arm straight up. And then I'm just going to ask the patient to slowly lower his arm, so go ahead and slowly lower your arm down. If there's pain while he's slowly lowering his arm down or his arm drops quick, this is a positive sign for rotator cuff pathology.